procedure where a blood vessel is reconstructed. Angioplasty. An irregular heartbeat. Arrhythmia. Listening to the sounds made by the body structures to aid in diagnosis. Auscultation. Abnormally slow heartbeat. Bradycardia. Enlargement of the heart. Cardiomegaly. Disease of the heart muscle. Cardiomyopathy. Used to denote the heart. Used to denote the heart. Coronary. Graphic record of the heart's action currents. Electrocardiogram. Blood clot. Embolism. Lack of blood in an area of the body due to the obstruction of blood supply. Ischemia. Inflammation of the heart muscle. Myocarditis. Pathologic death of one or more cells. Necrosis. Narrowing of a lumen. Stenosis. Abnormally rapid heart rate. Tachycardia. Narrowing of the blood vessels. Vasoconstriction. Opening of the blood vessels. Vasodilation. Profuse sweating. Diaphoresis. Accumulation of an excessive amount of fluid in cells, tissues, or serous cavities. Edema. General increase in bulk or size of a part or organ not due to tumor formation. Hypertrophy. Hives. Urticaria. An agent that relieves suppresses cough. Antitussive. The absence of breathing. Apnea. Deficiency or lack of exchange of oxygen and carbon dioxide during ventilation. Asphyxia. The drawing of foreign substance into the respiratory. Aspiration. Inflammation of the bronchial tubes. Bronchitis. An agent that causes widening of bronchi and bronchioles. Bronchodilator. Spasmodic contraction of the smooth muscle of the bronchi. Bronchospasm. Inflammation of the mucous membrane of the nose. Coryza rhinitis. Shortness of breath, subjective difficulty in breathing. Dyspnea. An agent that loosens and clears mucus and phlegm from the respiratory tract. Expectorant. Coughing up blood from the respiratory tract. Hemoptysis. Drug delivery device used to change medication from a liquid to a mist to be inhaled into the lungs. Nebulizer. Excessive discharge of mucus from the nose. Rhinorrhea. A high-pitched, noisy respiration indicative of respiratory obstruction. Stridor. To breathe noisily and with difficulty, usually with a whistling sound. Wheeze. Excess glucose in the bloodstream. Hyperglycemia. A deficiency of glucose in the bloodstream. Hypoglycemia. Excessive excretion of urine. Polyuria. Excessive hunger. Polyphagia. Excessive thirst. Polydipsia. Presence of protein in the urine. Proteinuria. Disease of the kidney. Nephropathy. Disease of the eye microvasculature. Retinopathy. disease of the nerves. Neuropathy. Small amounts of albumin in the urine. Microalbuminuria. Abnormally low number of neutrophils in the blood. Neutropenia. Increase in the number of red blood cells in the blood. Polycythemia. Deficiency in the immunologic response to disease, irradiation or drugs. Immunocompromised. Referring to an agent used to destroy or retard the growth of cancer cells. Antineoplastic. Referring to a tumor that is not malignant and does not spread to distant sites in the body. Benign. Any substance that causes cancer. Carcinogen. Referring to a drug that damages or destroys specific cells used to treat various types of cancer. Cytotoxic. Any disease of the lymph glands. Lymphadenopathy. Describing a tumor that invades and destroys the tissue in which it originates and can spread to other sites in the body via the bloodstream and lymphatic system. Malignant. Derived from a single cell having identical molecules. Monoclonal. Decrease in blood cell production by the bone marrow. Myelosuppression. New and abnormal growth, any benign or malignant tumor. Neoplasm. Decrease in number of platelets in the blood. Thrombocytopenia. Forced vomiting. Emesis. Chemical agent which induces vomiting. Emetic. Providing temporary relief from symptoms of a disease, not a cure. Palliative care. Difficult or painful urination. Dysuria. Severe pain in a joint. Arthralgia. Muscular pain stemming from fibrous tissue. Fibromyalgia. Excessive motility or muscular action. Hyperkinesia. A condition in which there is a loss of muscular activity. Hypotonia. Any abnormal condition or disease of the muscular tissues. Myopathy. Rigidity or chill. Rigor. Presence of bacteria in the blood. Bacteremia. Inflammation of both the skin and subcutaneous tissue. Cellulitis. Property of having a toxic action upon the organs of hearing. Ototoxicity. Presence of bacteria in the urine. Bacteriuria. Inflammation of the urinary bladder. Cystitis. Inflammation of the kidney and pelvis due to local bacterial infection. Pyelonephritis. Laboratory analysis of the urine. Urinalysis. Inflammation of the kidney. Nephritis. Emotional feeling, tone and mood attached to a thought including its external manifestations. Affect. A syndrome characterized by muscular rigidity and mental stupor. Catatonic. Relating to or involving both the mind and body, especially physical symptoms which are produced, at least in part, in response to psychic stimuli. Psychosomatic. Referring to drugs that are capable of affecting the mind. Psychotropic. Adjustment of the eye for seeing at various distances. Accommodation. Loss of the sense of taste. Azoiza. Azoiza. Vision in one eye does not develop fully during early childhood. Amblyopia. Absence of sense of smell. Anosmia. Double vision. Diplopia. burning or pain of the tongue. Glossodynia, sense of taste. Gustation, an agent that causes contraction of the pupil. Miotic, an agent that dilates the pupil. Mydriatic, sense of smell. Olfaction, property of having a toxic action upon the organs of hearing. Ototoxicity, ringing in the ears. Tinnitus, a subjective or objective sensation of irregular or spinning motion. Vertigo,